right, here we are at 9:15. Super excited to get started. So welcome back again. So I want to go ahead and introduce our next session and the moderator for that session. So we have Caroline Gomez-Tom, who is covering Wisconsin's Enrollment Network and Accessibility Manager. And she will be leading, this is a great title, the InBetween, Examples and Solutions when Helping Consumers Transition Between Medicare, Medicaid, Healthcare.gov, and other forms of coverage. All right, take it away, Caroline.
Wonderful. Thank you, everyone, for being on here with us. And I will introduce my co-facilitators or co-speakers, co-presenters in just a few short minutes. But I am really thankful to have you all on this session. We know that, and here, let me share my slides. We know that the in-between, or the time when someone is transitioning from one type of coverage to another, or even transitioning from being uninsured to getting coverage, is a really important time. We know that this is typically when people are concerned, whether it's they're worried that they're going to be losing coverage, whether they're going to be, not able to cover or pay for their benefits, or really it's just they're also transitioning in other aspects of their life. So it's already kind of this unknown. And one thing that I'm really proud of, and all of you in being an enrollment assister, a navigator myself, is that we are able to help people get through those moments of confusion, concern, fear, to help them get to the other side where they feel confident, know what coverage they have, know how to access their benefits. And that's one less thing that's no longer a weight on their shoulders. And they can focus and get back to the other things in their life that can cause them stress, because we know we are human and that is life. But yes, I'm excited to discuss the in-between, examples and solutions when helping consumers transition between Medicare, Medicaid, Healthcare.gov, and other forms of coverage. And I am so excited to introduce my co-presenters. We have Vicki Buchholz from the Medigap Helpline Services. She is the supervisor for the Medigap Helpline and is a part of the State of Wisconsin Board on Aging and Long-Term Care, and is really a state renowned expert around Medicare services. So we'll be glad to have her, especially when we get to the more complex issues and the latter part of the presentation. And we also have attorney Kate Schilling, who also is her own well-respected Medicare expert. So as you guys might know, I don't know how familiar you are with the work that I've done, but I'm Medicaid, Badger Care, health insurance marketplace gal myself. So to have these two side by side, I feel very confident that we'll be giving you a presentation that not only will you learn from today, but what I'm really hoping is that you'll save in your back pocket so that you know where to go for questions around some tough transitions, how to kind of step-by-step process some of the more common transitions, and then also have resources at your fingertips in me, Vicki, Kate, and really a lot of other useful partners across the state that can help you figure out your next steps when working with a consumer that might be going through a difficult transition. So we'll be reviewing Medicaid, Medicare, and Healthcare.gov coverage options. We will be identifying common times of transition between those coverages. We'll be understanding complex examples of transition and how to troubleshoot. And then we'll talk about some resources that you can access, because none of this information throughout the entire conference is something that you now have to absorb and know through and through. But what we can give you is how to find the information or person that can help you figure it out. So we're going to do a quick review of options, just because I know that you have been participating in other conference sessions and you're talking about these programs. And if you just did pre-licensing 2 weeks ago, you also have had in-depth discussion of the different options that are available to the people that we help. But I want to rename them and just make sure that we're all understanding the foundation of where people might be coming from in terms of the coverage that is available to them. So first and foremost, we have health insurance from a job. And the reason I say first and foremost is because if someone has access to affordable coverage, and affordable being as it's determined under the Patient Protection and Affordable Care Act, then this is usually the coverage that they should stick with, because if they have affordable coverage, then it's considered that they would not qualify for financial assistance in Healthcare.gov plans. They may or may not qualify for Medicaid because their income is higher if they're working. Potentially, there's still exceptions to that. And then if they're working or of working age, they're most likely not eligible for Medicare. And we can talk about those differences as well. Health coverage through a job affordability is 9.61 as of 2022, but as of 2023 will be 9.12% of a household income. And one thing that we are actually really excited about is the updated policy around the family glitch. So the family glitch was a policy that said that affordability is based on the employee's health plan. So if the employee had a health plan available to them, let's say in 2022 for 9.61% or less, then it was considered affordable. But if they were trying to enroll in a family plan for their family, and that was at a higher percentage of their household income, because the single employer plan was affordable, the family would not qualify for tax credits in the marketplace, even if it was 20% of the household income, 25% of the household income. And we saw that, unfortunately, a lot. So the Centers for Medicare and Medicaid Services actually are changing this policy. And I believe any day, any week in the next couple of weeks before open enrollment, I'm hoping, we will find out that the policy is final, where they will be looking at family affordability rather than just the employee alone. Or if the employee coverage is affordable, but not affordable for the family would be able to go to the marketplace, the Healthcare.gov marketplace, and grab financial assistance with their health plans. So we're really excited to learn more about this, but I wanted to make sure that we kind of knew the rules around getting health coverage through a job. And then I'll transition to Kate, and she'll tell us a little more about Medicare.
Great, thank you so much. Thank you, Caroline, and very happy to be here today, so thank you. As Caroline said, I'm gonna speak a little bit about Medicare, and a lot of people confuse Medicare and Medicaid, but I'm gonna be speaking about Medicare. And the way to qualify for Medicare is upon turning age 65, or if someone has been on SSDI, which is Social Security Disability Insurance, for 24 months, or if they have end-stage kidney disease or end-stage renal disease. Those are the ways to qualify. Now, Medicare, being different from Medicaid, doesn't have an income or asset limit. So, for example, anyone who is a US citizen or qualifying immigrant is going to be eligible at age 65. We're going to talk a little bit later about work credits, and work credits only determine whether or not you pay a premium for Medicare Part A. There's a lot of confusion when people sign up Sometimes they're even told they don't qualify because they didn't have work credits. That's not the case. Work credits don't ever determine eligibility. They just determine whether someone pays a premium for Medicare Part A or not. Most people, about 99% of the people actually get Medicare Part A for free. And that's either through their own work history or through a spouse's work history. So that's usually not an issue, but sometimes it is. And of course it is in terms of transitions from Marketplace to Medicare. So we are going to talk about that. But I wanted to let you know the ways to qualify for Medicare, and also if someone is turning 65 and they know that they're ready to enroll in Medicare, the way to enroll is to go directly to the Social Security office. They manage Medicare A and B enrollments. So you can either call them on the phone or you can do online through the Social Security portal. You can log in and set up an account. They'll usually ask you some questions off your credit report. So sometimes that is an issue, but they want to make sure it's the right person. So if someone turns 65 and they know they need Medicare right away, if they don't have any questions about that, they can log in, they can get their Medicare that way, or they can call Social Security and make an appointment. Usually Social Security is doing phone appointments, sometimes in person, but since the public health emergency, they reopened in April, and it's just been difficult to get an appointment. So I just wanted to let you know that. Now, people that have questions about when they should start their Medicare, maybe they have retiree coverage, we need to talk about that. Maybe they have certain other kinds of health insurance coverage. If they need to talk about their options, that's when they go to an ADRC, an Aging and Disability Resource Center, or they would go to, they could call the Medigap helpline, which is where Vicki works. And then I wanted to say one more thing about that, and that is if someone is already receiving Social Security disability benefits for 24 months, or if they're receiving the early retirement Social Security benefits. So say they started drawing at age 62, when they turn 65, their Medicare cards are going to come automatically in the mail. Social Security assumes that if you're already drawing Social Security early retirement benefits, you're probably not working, and that means you want Medicare to start right away. You actually have to affirmatively reject them and refuse them if you don't want them. So turning 65 is a 7-month window. We call this your initial enrollment period. And so this is going to be the 3 months before you turn 65, the month you turn 65, and the 3 months after. So if someone enrolls in Medicare during the 3 months prior to their birthday, their Medicare will start the first of the month on their birthday month. And then if they enroll in the 3 months after, their coverage is going to starting in January, the first of the following month. For 2022 and all the years before, there's been a big delay of 2 to 3 months from the date you enroll, but that's going away starting in January. So generally speaking, it'll be the first of the month following the month you enroll. So if you enroll in May, and that's month 5 of your IEP, your coverage will start June 1. So that's a big change, and that's a good change for beneficiaries because they can get the coverage sooner. So that's a really good thing. So we're looking forward to that. And so the 7-month window is important. Once people lose this window, they may not have another chance to enroll. They kind of miss the enrollment, and they might have a late enrollment penalty. So very important for people to be aware of this. And there are only certain times when you can refuse Medicare Part B, and we're going to talk about that.
Wonderful. Thank you, Kate. We're already getting some questions. And so one of them is Medicare related. So are some people automatically enrolled in Medicare?
Yes, great question. So if someone is taking early early Social Security retirement at 62, 63, or 64, if you're already drawing Social Security early retirement or SSDI benefits or SSI, supplemental security income, which has income and asset limits, then those people are going to automatically get their Medicare cards in the mail like a month or 2 before they turn 65. So that Medicare starts automatically for them upon their 65th birthday. And if they didn't want Medicare A and B for some reason, they would have to affirmatively disenroll, because the assumption is that they do want it.
Perfect, thank you. All right, and then someone asked if someone, and this one goes back to the employer-sponsored coverage, but if someone gets coverage from a job and terminates their marketplace plan, do they need to report a life change in their current year's application, or is the termination of the plan enough? And so I'm making some assumptions, but is it terminating the marketplace plan on their own, not not losing it for some other reason? So just terminating a plan would not allow for a special enrollment period or a specific life change. But now I understand what the question. I'm so sorry. I understand the question. So if someone is getting coverage from a job, newly getting coverage from a job, and are they able to terminate their marketplace plan to get the coverage from their job? And the answer is yes, they can terminate their marketplace plan at any time. And once their job coverage is made available to them, whether that is an open enrollment period, then they can make that transition from not having employer coverage to then now having it and frankly, with no issue, as long as they're enrolling in their employer coverage as soon as it was available to them. So no issue with the tax credit question. All right, and then we have a few more, but I think I'm going to wait till we get to the end of this section, and then we'll get to a few more of those questions. But thank you. Continue to add the questions that you have throughout the presentation in the Q&A section. All right. So then we have Badger Care Plus and Healthcare.gov coverage. And I won't go too in depth with these programs just because I know this is the majority and bulk of what you guys have been discussing over these last 3 days of the conference, Friday, Thursday, and Wednesday. But as we know, Badger Care Plus is a low cost or free coverage provided by the state of Wisconsin, known as Medicaid. Also, people know it as the Forward Health program because they get a Forward Health card. It's a program for low-income adults, parents, and children. Also, Medicaid is available for people with who are elderly, blind, and disabled. And then people can sign up at any time on access.wi.gov. And people can also sign up for food share and child care assistance at the same time. And there's in-person assistance like navigators, enrollment assisters, and public benefit specialists who are able to help people sign up. People can also call their income maintenance consortia over the phone, and then people can apply on access.wi.gov online. One other feature, it doesn't allow you to enroll in Badger Care, but it's a really useful tool is the My Access Wisconsin app or application that people can use and log into with their credentials from their access.wi.gov website. And this allows them to check for their renewal dates. We'll talk about that. They'll also be able to check if there's any status pending. So if they need to submit verification, they're able to upload documentation on the My Access Wisconsin app. And overall, it's just a great tool that consumers can use to make sure that they feel connected to their benefits and stay on top of any changes to those Medicaid benefits. One thing that I really appreciate about it as well is that they actually have a digital Forward Health card. So if someone loses their Forward Health card, they can have that information readily available on their smartphone. And one thing that I like to make sure that folks have access to are the benefits of Medicaid. Benefits are comprehensive, including health, medical health, mental health, behavioral health, dental, vision, and many more services. And so this link will get you to a document that kind of goes more in depth with what Medicaid benefits are available. And it's a great resource from the Department of Health Services. And then people need to renew every 12 months, with the exception of the moment that we're in right now, for their Medicaid benefits. We know that because we're still in a public health emergency, and that has been extended over the last 2.5 years, people have had their renewal requirements paused. So there are currently 1.5 million people, well, close to 1.6 million people enrolled in the state's Medicaid program, that when that public health emergency ends, will need to renew or reapply for their coverage for the first time in what will be nearly 3 years. And so we're preparing all of our partners with that information, and there's a wonderful toolkit from the Department of Health Services that goes in depth of what you could be helping and sharing with your network and your the consumers that you serve now. But once the public health emergency is over, it'll go back to the policy and rule where people are renewing every 12 months. And then Healthcare.gov, the health insurance marketplace, that's where people can get coverage when they don't otherwise have access to coverage. So we're talking about people that don't have access to Medicaid, don't have access to Medicare, that may not have access to affordable health coverage through their employer. They can go to Healthcare.gov and seek financial assistance to help lower the cost of their monthly premium or the monthly cost of insurance. There is an open enrollment period that we're all preparing for, which is November 1st through January 15th. And there's also special enrollment periods, which really are moments of transition, which we will get to shortly. And then open enrollment, we like to flag or highlight the fact that even though the period goes through January 15th, if people want coverage to start on January 1st, they do need to apply by December 15th. That's the deadline for January 1st coverage. And then they still do have till January 15th, but that coverage wouldn't start then until February 1st. All right, so I'm going to pause one more time, and then we're going to get some of these questions answered. So it says, okay, so we got that one. So a single immigrant who has only worked in the U.S. for years, I don't know if you mean 4 years, would they qualify for Medicare benefits? Maybe Kate or Vicki, could you just address maybe what is the requirement in terms of work credits, regardless if someone is an immigrant or not?
So for immigrants, I think it's really best if they talk to someone one-on-one to talk about their eligibility for Medicare, because sometimes based on their own status or eligibility, they might not qualify. But I recently had a case where after we did some digging, we found out that the woman's spouse was a veteran and therefore she qualified for Medicare. So I think it's really important not to try to generalize, and I don't like to try to answer these in a general way, because I don't want to say yes or no, they would be eligible, because then people think that will pertain to other people. With any kind of situation where someone is not a citizen, I like to look at them on an individual basis. So I would refer that person to either the Medigap helpline or an Aging and Disability Resource Center for some more specific counseling.
Fantastic, thank you. And then if a person that turned 65 and has Medicaid coverage, however, they don't have enough work credits, you know what, Sonia, we'll get to your question, because I feel like this is one of the perfect examples of our transitions. So we will definitely talk about your question. And then let's see. I wanted to address one more, at least in the meantime. There was someone that asked about undocumented women who are pregnant. How long after they give birth will they continue to have state insurance? And that question was really well answered in one of our previous sessions earlier last week. It was actually the session with the Department of Health Services, where they did more of a deeper dive in some of the more complex Medicaid questions. And it is someone who is undocumented who is pregnant can qualify for Badger Care prenatal, but then once they have given birth, they will lose that Badger Care prenatal, with the exception of right now with the public health emergency that got extended, but normally would lose that Badger Care prenatal at the time of them giving birth, or at the end of the month that they gave birth, and then they would qualify for the emergency services for the next 60 days. So I would suggest going back to that session because all of these sessions are recorded, and get a deeper dive into that particular question. But thank you for asking it. All right. So then we go into these moments of transition. So what are transitions? It's when something happens in a person's life that requires a change in coverage, what we also then call, frankly, special enrollment periods. And extra care is needed during these moments because we know that it could result in a gap in health insurance coverage and potentially people foregoing the care of significant medical issues, and something that we do not want to see happen, because we know that when someone goes uninsured, they're less likely to seek assistance or care that they need. And prevention and early detection of health care concerns or issues is important, both for the health and well-being of the individual, but also cost. All right. And I'm getting a little flag. Mike, we can have the second polling question up right now if you'd like. This is also exciting. We have so much going on. Wonderful. So the panel polling question is, would you benefit? Oh, I'm sorry. I don't think this is the right question, Mike. I think this might be for the next. I was like, QHPs. Let's see. Yes, this is the one. So what actions should a person receiving Social Security early retirement benefits take upon turning 65 to get their Medicare started? What do you all think? And I think we give like about a minute for you to answer. All right, and I'll let Kate actually go into the answer once it switches over. There we go.
Great. All right. Great job. It looks like about 39% of the people said nothing. 2% said call the Income Maintenance Consortium. 13% said call Medicare at 1-800-Medicare, and 47% said contact Social Security. So this is a trick question. Someone who's already receiving Social Security benefits. So that's either SSI, which is, well, here I have early retirement. So early retirement is one of the benefits, or SSDI, or supplemental security income, which is income and asset based. So here, if you're already receiving your Social Security early retirement benefits, you don't have to do anything. So the answer is nothing. That card for Medicare A and B is going to come automatically to you in the mail. And you have to affirmatively turn it down, actually, if you don't want it. Now, I did want to just say real quick, Social Security is where you go to sign up for Medicare A and B if you're not drawing early retirement benefits and you want to take Medicare A or B or both. And even if you're still working, you can usually still have Medicare Part A. Income maintenance actually helps with the subsidies for Medicare premiums. And 1-800-Medicare will help with Medicare Part D, but not A and B enrollments. So everyone has a little piece of the pie there, but the answer was actually nothing.
Wonderful. Great explanation, Kate. Thank you. So now we're going back into transitions. And so we're going to talk a little bit about some of the most common transitions that we see. So for folks that have been doing Healthcare.gov enrollments for a few years, if not the entire time that it's been around, you'll be most familiar with these types of transitions. For folks that are new, this is going to be a great resource for you. And we actually have a how-to sheet on Covering Wisconsin's website, specifically laying out all of these special enrollment periods. And these are the most common ones that we see when someone loses their health insurance, either from a job, COBRA, if they lose Medicaid coverage, a student health plan, parents' health coverage, changes in income. So if there's a significant change where, changes in income or household size. So if there's a significant change in someone's income, so for example, they get a raise and they need to modify the financial assistance that they're getting through Healthcare.gov, or if they have a baby or they adopt a child, marriage, divorce, death can also trigger a special enrollment period, specifically when coverage is being lost due to that transition. If someone's moving into a new area where their current health plan no longer is available, that also triggers a special enrollment period. Immigration, so a change in status where now they're newly eligible for coverage, that's a moment of transition. And then when someone is released from incarceration or jail. One that I'll also mention that's newer is that folks who have lower income can apply for Healthcare.gov coverage at any time. So this isn't low income in the sense that they would qualify for Medicaid, but as long as they're below 150% of the federal poverty level, which really for a single individual, you're looking somewhere around $18,000 to $20,000. They would be able to enroll in healthcare at any point in time. Folks who are tribal members can actually enroll once a month in a special enrollment period. And then if there's a mistake on an application by a professional that's helping you, or you have a hardship, and in many cases, like a medical emergency or financial hardship, or even if many cases, the pandemic actually resulted in a lot of hardship special enrollment periods, there are some ways to get into Healthcare.gov coverage. Consumers typically have 60 days before and after losing their health insurance to enroll in a plan through the health insurance marketplace. Some consumers, like tribal members and people making less than 150% of the federal poverty level, can apply at any time. And then coverage will start the day, the first day after the month is selected, if they're doing it before the end date of their lost coverage. So for example, let's say I'm going to lose coverage this month, and I know that it's through October 31st. If I apply for Healthcare.gov coverage anytime prior to October 31st, my new coverage will start November 1st. But if I wait till after my coverage ends, which I still have another 60 days to apply after I lose my coverage, the coverage won't start until the first of the next month. So for example, if I apply for coverage before November 15th, my coverage would start December 1st. If I wait until November 16th, then it won't be until January 1st. And then so on and so forth for those 60 days after I lose my coverage. So we really want to promote that if people know when they're going to lose their coverage, in some cases, people might not know when they're going to lose it. But like if they're, quitting their job, or they got let go, typically their employer coverage not always will extend the coverage through the end of the month of when they're losing their employment. And in other cases, for example, if they were to lose Medicaid, there's usually a 45-day notice that goes out that would then let them know when they when their final day of coverage would be, and when they could already start thinking about enrolling into a Healthcare.gov plan. All right. And so I've already mentioned the public health emergency a few times, but one thing that we haven't really talked about are what do transitions around the public health emergency looks like. So when people have to renew and reapply for their Medicaid coverage, in many cases, there will be a lot of folks that don't have to transition at all. They'll renew and reapply, and then they'll be able to maintain their coverage, which we're hoping is a larger majority of the folks. But we also know and realize that there are going to be many folks that will need to transition to another type of coverage. So in many cases, we'll be looking at a variety of options. So people who find out that they're no longer eligible for Medicaid based on their monthly income may look at their annual income to see if they actually still may remain on Badger Care through Badger Care gap coverage. I'm not sure if this is discussed in another session, but gap coverage is when someone finds out that they're no longer eligible for Medicaid because of their monthly income, which is typically how Medicaid is determined. It's looking at what the household income is for each month. But when they look at their annual income, when they're applying for Healthcare.gov, which is what Healthcare.gov looks at for income, they find out that their income is still too low on the annual level. And that can happen for a variety of reasons. But when that's the case, they still could be found eligible for Medicaid based on that annual income. And it's typically best to work with the Income Maintenance Consortia directly to make that transition back to Medicaid if their annual income is still too low. And there's also trained navigators that can help through that process. So I do really recommend even enrollment assisters that might find their consumers in that stage of making too much monthly, but their overall annual income is still too low. Us navigators can be a resource to you to help get the consumer to the right place. There also may be access to employer-sponsored coverage for these folks that are no longer eligible for Medicaid after the public health emergency is over. So checking for affordability using that resource that I shared earlier in the session and using that number, the 9.12% for 2023 of their household income to determine if they should be going to their employer-sponsored coverage. And then finally, checking Healthcare.gov for financial assistance and to see what plans are available to them and their family. And then I believe, Vicki, you'll talk about most common transitions for Medicare.
Well, thank you very much for having me included in here. So Medicare itself, as Kate stated, is eligible for people if they're on disability, age, or ESRD. However, to get premium-free Part A, you need to have had 40 work credits, less credits if you're young. So there are some differences there. But for a lot of people who delay Medicare Part B, because Medicare Part B has the premium, if a person delays it because they are covered by an employer plan because of active work employment, whether it is theirs or a spouse, then they do get what's called a special enrollment to then sign up for Medicare Part B when they do retire, anytime while they're still working, up through 8 months after they retire. So that is why when we look at Medicare getting into Part B, it's not as easy as we think. It's because the only special enrollment they give right now is because of the employer-sponsored plan. They are looking at, because of the pandemic and because of Medicaid, and a lot of people in Badger Care Plus who elected not to take Part B when their Medicare began, they did not lose Badger Care Plus because of the pandemic. Those persons, CMS is looking at starting a SEP for loss of Medicaid. I'm waiting to see those regs if it ever gets passed. But for now, just keep in mind employer group, active employer group. So that's where it's important to talk to somebody, whether it's with the ADRC, whether it is with the Medigap helpline, just to understand some of the enrollment periods with Medicare itself, which is the next slide. So when we talk about the enrollments into Medicare, there are 3 types of Medicare enrollments, 3 types. The first one Kate did a great job with is the initial enrollment period. When they first turn age 65, whether or not a person is still working or whether or not when they turn 65, that is their initial enrollment, 3 months before, month out, 3 months after. For a person that's on disability, their 7-month relates around that 25th month. After 24 months of disability, that 25th month, Medicare would begin. If a person is receiving their Social Security money benefits, they cannot turn down Part A. They need to take Medicare Part A if they're receiving funding, Social Security money benefits. But Part B, people can turn down or withdraw at this time. However, we caution people to make sure that they're covered by that active employer plan to avoid the risk of a penalty later on. But some people do. Some people do. So then there is that next opportunity for a person to sign up into Medicare Part B to get Medicare started. Or if they're on premium Part A, where they have to pay a premium for Part A, then they could also sign up again during what's called the general enrollment period. The general enrollment period is from January through March, the first 3 months of the year. And during those 3 months, a person can enroll into Medicare Part B or premium Part A and Part B. And it used to be that it wouldn't start until July. However, because of the programs that they're looking at, they've changed that enrollment. So now when a person enrolls into Medicare during the general enrollment period, the coverage will start the first of the following month. No longer will we have that months delay, that 5, 6, 7 months delay for Medicare to start. If they sign up January, February, March, it'll start the first of the following month. So that is a great thing for there. Okay, I did see a question pop up here quick about employer coverage. Must be a large employer. That determines who's primary, who's secondary. If it is a greater than 20 employee, a person age 65 or over, Medicare is secondary, no problem with not taking Medicare A and B. However, if it is under 20, the person that is age 65 or over will still be able to waive. If they don't take any money benefits at all, they can hold off on Medicare A and B and they will not incur a penalty. So that is a great thing right there. So, but if it's for a person that's on disability, then we're talking 100 employees. So a person under age 65 to have that primary status, secondary status. And remember, a person on disability is receiving disability benefits. So therefore, their Part A will automatically start. But waiving Part B depends upon how many employers. And that's why it's important for people to call if they're unsure whether or not they should waive Medicare Part B or not enroll at all into any of their coverages. Anyway, so that's general enrollment. And the third special enrollment is Medicare Part, is the special enrollment for Part B. And this one is pertaining to a Medicare enrollee who waived Part B because they were covered by theirs or a spouse's active employer coverage. Now, if a person's on disability, they can also have coverage from another family member. However, once a person's 65, it has to be their or their spouse's coverage to waive Part B, and they will get Part B back with no risk of penalty. So any questions at all with these enrollments or before decisions are made to waive coverage, they really do need to talk with somebody to be in the know, because it can be confusing when you start comparing all these enrollment periods with what everybody else has with Medicaid or the marketplace. It gets real confusing there.
Definitely. And I feel like we have a couple of clarifying questions in the chat. So I'm going to read them off to you, Vicki, and we'll see if we can rapid fire some of these. So if they don't turn down Part B and don't want to take it until a couple years later, how much is the penalty to take it out later?
If a person voluntarily turns down Part B, if they're covered by an employer plan that's based upon active employment by their or spouse, assuming they're over age 65, typically you have to be without Part B for 12 months before a penalty, a 10% penalty, is incurred. But if you're covered by an active employer plan, there is no penalty. That's why it's important to have that letter of creditable coverage when you lose that coverage, to show that to Social Security, to show that I've had coverage, no penalty. But let's say a person decides that they want to remain with the marketplace plan. We've had those questions come through. If they stay with the marketplace plan, it is not an active employer plan. I'm not talking a shop plan. I'm talking a regular marketplace plan. Therefore, if they don't take Medicare within 12 months, they're not covered by an active employer plan. Therefore, they will incur a penalty of 10% for every 12 months. And that penalty is for the rest of their life. Now, if a person's low income and qualifies for a Medicare savings program to help pay the premium, then that penalty goes away as long as they maintain Medicare coverage from that point forward, once we go forward with that. So it's 10% every 12 months, bottom line.
And when does the new general enrollment period become effective on this new rule today?
January 1, 2023,
Perfect.
right away.
Thank you.
So from now going forward.
And then this might be just a comment, but I'll let you add on. You cannot waive Medicare Part A and B if you work for a small employer. If you waive, you will not have insurance because the small employer insurance is secondary to Medicare. Can you add that? And Kate too, if you want to add.
I have had, typically we would tell people don't waive Medicare because you do run the risk of the employers say, no, we're only going to pay as secondary coverage. I have had a few employers that didn't care. They paid anyway. Paid anyway.
Okay, I want to step in because I've had the opposite happen many times. So by law,
Yep.
Medicare is primary if it's 20 or fewer employees. So if someone doesn't take Medicare, Medicare would have paid primary. If they don't take it, employer and retiree coverage does not have to pay. What they will do is they'll pay the remaining 20%, and then they will, the initial 80% will need to be paid by the client. What happens though is it doesn't happen immediately. The employer coverage will sometimes pay for a couple of years. I've seen it pay for 5 or 6 years, and then it retracts coverage and says, oh, wait, you should have been on Medicare that whole time. Excuse me. We don't need to pay. We shouldn't have paid. We're retracting coverage. And when they go to retract coverage, honestly, there's not much we can do at that point. All I can really do is send someone to a bankruptcy attorney then, because they have usually about $500,000 of medical bills that are not going to be covered. You cannot get retroactive Medicare unless you have end-stage renal disease. So the clients, I do want to say that this person who made the comment is absolutely right. You technically on the books have the option of declining, but that would be a very stupid choice, because you would essentially have no coverage. Now, I will say this has happened to me where clients have come to us after the fact, like 5 or 6 times. And like I said, I've had to refer them to a bankruptcy attorney because there's nothing else I can do. But there are, so this is by law. So by law, Medicare is primary in the under 20 employee situation. As Vicki was saying, an employer can decide to override that. They can elect if they want to be primary in that situation. But the only time I've ever seen that happen is with unions. So it might happen more often. And I've said, I will always volunteer to read the person's fine print of their policy. But 99.999% of the time, the Medicare is going to be primary because it is by law, unless the company puts it in their plan documents that they're going to override that. So they always can elect to do that, but it's not very often. So even if someone comes to you a year after they've, become eligible for Medicare and they've said, hey, I don't need to take Medicare, everything's working fine, just remind them it might work fine for the first 5 or so years, but they will retract coverage as soon as they audit. And at that point, there's nothing we can do. You have to address it during the initial enrollment period or immediately thereafter. And you have to fix it as soon as possible, because this is going to be, you have to stop the bleeding, so to speak, right? So I do agree with the comments on that.
It is costly. I have run across it a couple of times where the active employer plan kept the person on as if age didn't matter. They didn't worry about Medicare at all. The person was still actively working and did not have Medicare A or B at all. So that, so that's totally different, but I agree with you. You have to look at the fine print. You have to understand exactly what it has. And we at the Medigap Helpline always counsel to err on the side of caution, and they need to really understand that better, or they do run that risk.
And the other problem is, oh, sorry, go ahead. Sorry, finish.
If it's a retiree group or if it's a COBRA coverage, we've had people come back with major expenses as well because they didn't take Part B, but when they called, they said, I'm covered by an active employer plan, or I'm covered by my employer plan, and nobody ever warns them. You need to have Medicare A and B because now it is definitely secondary coverage, regardless of the numbers. So even within these different twists and turns, strange things happen once in a while. So
yeah, and that's one of the reasons why I'm so glad to have you both in my network and your organizations in my network, because I think that's really the takeaway, because the thing is, I'm going to watch this video back. I'm going to make sure that I have a better understanding of the transitions with Medicare. But at the same time, I also know I'm not going to memorize this. It's not possible. We have experts that are able to memorize this, like some of us can memorize the work around Medicaid and Marketplace. And so I'm going to go to you all. I'm going to go to your organizations when I have these questions, just to make sure that the consumer I'm working with is in the right hands and is, doing what's best for them in their situation. So really, I can't emphasize that enough. It's just, you don't need to memorize everything. You don't need everything at your fingertips, but you need to know where to find it and who to get help from. All right, so we're going to transition to, if you can believe it, the complicated transition examples. And then hopefully answer some questions before the end of our session. But I think so far we're doing good on time. So the first example that I wanted to bring up is someone with a new immigrant status. So let's say someone becomes a permanent resident, so they have their green card, and they've only been in the country now for, let's say, one year, and they have their permanent residency. So immigrant adults who don't qualify for Medicaid. So for example, if someone is here with their permanent residency, their green card, but they've only been in the country for less than 5 years, Medicaid does not, and they're an adult, there's some exceptions for children and pregnant women and things like that. But if they're an adult who's been here for less than 5 years, they will not qualify for Medicaid. And then because they're also here for less than a certain amount of time, they're less likely to have the work credits that are required to qualify for free Medicare Part A. So if that's the case, then they can qualify for marketplace coverage with tax credits, even if their income is below that 100% of the federal poverty level. A lot of people do not realize this, that in many cases, not even if you have a green card, but if you're of an eligible immigrant status that is making less than 100% of the federal poverty level, they can qualify for Healthcare.gov. And in many cases are paying as little to very little, in some cases paying as little as $0 for their monthly premium to have coverage. And so this is typically immigrants who, once again, are in that 5-year wait period. We also see a lot of immigrants who are 65 and older, who would need to pay for Medicare Part A if they are eligible. But because they have to pay, they're not required to take that Medicare Part A premium Part A, and can go to the marketplace and still qualify for financial assistance. And then immigrants who are legally present, who are not permanent residents, that includes folks that have work visas, students, they all can qualify for Healthcare.gov. And there's actually a long list of eligible immigrant statuses. I think it's sometimes easier to talk about who's not eligible in terms of immigrant status for Healthcare.gov. And those two big categories, there's some exceptions to that too, but the two big categories are folks that are completely undocumented, so they don't have any eligible status within the country. And then unfortunately, the folks that are dreamers or the deferred action and childhood arrivals, even though they have a work permit and even though they have a social security number, they still are not eligible for Healthcare.gov. And part of that is because when Healthcare.gov or the Patient Protection and Affordable Care Act was passed, the deferred action and childhood arrival program was not in place. That actually passed several years after the ACA was passed. And so there is a question of whether or not the Centers for Medicare and Medicaid Services could actually change this rule and policy. And there are some national organizations that are looking into that to see if that's something that later on could be adjusted. But one thing that is important is that the person who is of this immigrant status that might be in the country now for a long time, after they hit that 5-year wait period, they may be eligible for Medicaid, or if they're working, maybe they are then eligible later on for Medicare Part A without a premium. And if that's the case, as an enrollment assister, we encourage you to kind of help map out what their options are going to be, not just for this year, but kind of what they should expect for the time that they're in the US. because maybe you're helping them and it's actually year 4 of the time that they received their permanent residency, and one more year they're actually going to be eligible for Medicaid. And so knowing kind of what to expect, knowing what to anticipate, knowing that they can come back to you and ask questions, I think that is the difference between them getting the coverage that they need and getting the care that they need, or them not knowing what's happening and then potentially losing coverage, or not benefiting from the resources that are available to them come that 5th year. And they also may need other things as they age. And so knowing all of the resources and what would make the most sense for them is also going to be crucial. So making sure that when it does get to a point where they need to assess the plans that are on Healthcare.gov, or maybe compare them to paying for Medicare, and if that's actually a better resource and circumstance for them and their situation, that's also worth exploring. And one thing that I want to acknowledge too is that we have heard of some qualified health plans actually not covering certain services for folks that have Healthcare.gov plans because they believe that the individual, because they're 65 and older, should be on Medicare. But they're of this immigrant status, they're in, they wouldn't be able to get Medicare for free. It would be a paid version. So they do have the right to stay on their Healthcare.gov plan with the financial assistance and have benefits paid for. We've had to push some of these qualified health plans to make sure that they're looking at their policies. And we've had one plan in particular actually change their policy to make sure that these folks were cared for appropriately. And so we just encourage all of our qualified health plan partners on the call today to make sure that you also know your own policies and what's in place to make sure that, one, you're abiding the law, but you're also caring for your members, even in these more nuanced circumstances where you might think they're eligible for Medicare, but in reality they're not, and have the right to stay on the plan that they're enrolled in. The next complex issue that we actually hear a lot about, and it really is something that shouldn't be that complex. So we've had Kate and Vicki talk about people who are enrolling in Medicare because they're either in their 25th month of disability, or they turned 65, or they will be turning 65, and they are going to get Medicare Part A for free because they have a proper number of work credits, and they just need to cancel their marketplace plan. That might sound so easy, right? Like their coverage starts next month. They just need to cancel their plan. Well, I'm going to tell you, we have heard time and time again where this just does not happen seamlessly. And it's unfortunate too, because then there's like overlapping coverage. People are enrolled in 2 plans at the same time. They're going to might have to pay back some tax credits. If they're dealing with any health concern, now there's a qualified health plan from the marketplace and Medicare arguing about who's the first payer and who's the secondary payer. It's a mess, right? It's a mess for someone who really just thought this was going to be simple. And so we actually talked with the Centers for Medicare and Medicaid Services to get kind of the most up-to-date rule about when should you cancel a marketplace plan when someone is starting their Medicare coverage. And what we
Oh, Caroline, I lost you. I'm not sure if other people did, but you froze up on my end.
Yeah, so it looks like she is having a little bit of a issue right now. I will reach out to her personally really quick, and in the meantime, if you guys are able to cover some of her content really quick.
Yep. So this next slide was going to be mine anyway, so that works out just fine. So as Caroline said, we've had a lot of people having problems with disenrolling from the marketplace and then starting their new coverage. So the first thing is really important, and you guys probably know this, but for disenrollment, you have to go through the marketplace itself. You cannot go to the plan. So we have a lot of, especially the older adults I work with, they go to the plan, and that is problematic. So I'll go to the next slide, then slide 22, please. Thank you. So for someone with a disability determination, this would be someone who's on, usually someone on SSDI, Social Security Disability. As we said before, they're going to qualify upon 24 months of Social Security disability benefits. That's when they'll qualify for Medicare, okay? So a lot of people who have a significant disability, such as on SSDI, aren't working anymore. So then they'll say, well, what are my options for coverage? So then we will help them consider the options if they go to the ADRC or if they go to the Medigap helpline. And so some of the things that we might want to explore with them are, number one, is there a chance they'd qualify for Badger Care Plus? And Badger Care Plus, or as Caroline was saying earlier, there's what's called like a coverage gap, where it's the people who would, we called them churning before, where they'd go back and forth between Badger Care Marketplace, Badger Care Marketplace. Now the law says that those folks can stay on Badger Care. So we look at the Badger Care, these are usually in my case childless adults, but it could actually be families. So we look at Badger Care to determine if they're eligible or would qualify for Medicaid that way. We would also look for, would they qualify for any form of EBD Medicaid, and that's elder, blind, or disabled Medicaid. So another thought right off the bat is, if they just got a disability determination, would they qualify for MAP, which is Medical Assistance Purchase Plan? And that has higher income and asset limits. It's an asset limit of $15,000, but someone might qualify because the income and asset limits are much higher than other forms of Medicaid, which we know the asset limits are $2,000 if you're single and $3,000 if you're married. And those haven't been increased since, I think, the 80s, maybe before I was born. So MAP is going to be sometimes a better option because it's a little more flexibility. Now, MAP does require a work requirement, but that's, but in-kind work is okay. So like I said, I have a lot of older adult clients, and some of them are knitting doilies and selling them on Etsy. Some of them are knitting scarves. So some people are also doing childcare for grandchildren. So the work requirement is very, I'll say, inclusive. So there are certain requirements, but it's easy to meet generally, and some people are already doing it. So definitely they should be screened for elder, blind, and disabled Medicaid or other forms of Medicaid, including Badger Care as well. And then also the marketplace is a great place for people who don't have other coverage from any other source, right? For people who don't have employer coverage or affordable employer and coverage, or if they don't qualify for Medicare or Medicaid, right? The marketplace is a great place. So that's definitely a good option. Now, something for people to consider is once they qualify for SSDI, they start getting the benefits, and their income is going to go up significantly as soon as, I say significantly, but their income will go up a decent amount once those SSDI benefits start. So maybe they were waiting 2-3 years for an SSDI determination. They might have been on Badger Care Plus at that point, but if they suddenly become eligible for SSDI, they're going to usually have a jump in their income, and they might not qualify for Badger Care Plus anymore. So that's when it's important to screen them for the other options. All right, next slide. All right, I think this is Vicki.
Yes, this one happens to be me talking about ESRD Medicare. The questions that we get a lot from a lot of people. Now, ESRD, end-stage renal disease, these are people that have been on dialysis, either after 4 months of being on the 4th month of being on dialysis, or if they're on home dialysis, Medicare can start right away, or the month of a transplant, ESRD Medicare can start right away. So, but these people, they have a right to choose whether or not they want to enroll in ESRD Medicare. And we usually look at what do they have for current coverage, if they're on a marketplace plan, if they're on Medicaid, if they're on an employer group plan, we look at what their out-of-pocket costs are. Oftentimes a person has already maxed out the deductible or the maximum out of pocket of whatever plan they're in. And it may be in their best financial reasoning to stay with that employer plan, to stay with the marketplace plan, and delay enrolling in ESRD Medicare. Now, if they're in an employer plan, there's a 30-month coordination period we pay attention to know at the end of the 30-month they do need to flip. So an employer plan cannot encourage a beneficiary to sign up for ESRD Medicare. That came through the Office Commissioner of Insurance to verify that with employer plans. A beneficiary also, ESRD person, can also decide to wait on ESRD Medicare and stay with their marketplace plan. And this has been one of our ongoing issues with some people, is the confusion over, do I have to take Medicare? Do I not have to take Medicare? And these people do not have to take Medicare. We do review their options. We help them understand the different levels. If the person is on a transplant list, or if they're looking at needing a transplant, or they're scheduled for that transplant, we do encourage them to sign up for ESRD Medicare. They'll need to make a transition away from the marketplace into maybe a supplemental policy, but that way Medicare Part B will pay for immunosuppressant drugs for that person for a lifetime, because it's important that they be covered underneath the transplant that's covered by Medicare. So we do help people look at all the different options that are available for them. So we encourage anybody who has a client or knows somebody who's on dialysis looking at Medicare to please call one of the resources to help them really take a look at, this is what happens if you stay on what you've got. This is what'll happen at the end of the year when you start a new year, what's your out-of-pocket costs compared to the out-of-pocket costs of Medicare as supplement and Part D, and what goes on from there. Keep in mind, however, if a person has turned age 65 and they're on Medicare based on age, or they're on Medicare based upon disability, that changes the full story, because they cannot choose to not take those if they're receiving money benefits. I'm talking a person that's ESRD Medicare only. That's when we come into some of these distinct options and choices that a person has to have. So, and sometimes we will utilize the ESRD Medicare, the enrollment in there, to take care of any late enrollment penalty they may have had. So it is a complex situation with a lot of different varying enrollment periods when we look at ESRD Medicare.
Wonderful. Thank you, Vicki. And I think this goes right into our next polling question. So I don't know if we can bring that up. And can you guys hear me?
Yes.
Yes, wonderful. Sorry about that. Thank you for helping me out. But here we have this next question. It says, Emily, aged 52, has a marketplace plan and recently has been diagnosed with ESRD, end-stage renal disease. She reached out to an assister to discuss her health care options. So I'm going to read through the options. Since Emily, so these are your choices. Since Emily already has a marketplace plan, she can keep that plan along with starting ESRD Medicare, and the two coverages will coordinate with no loss of tax subsidies credits. Number 2, Emily is required to enroll in ESRD Medicare, which it will automatically replace her marketplace plan. 3, Emily may enroll in ESRD Medicare at a later date to keep her marketplace coverage intact. Or 4, Emily needs to flip a coin or rub a crystal ball to select which option works best for her. So go ahead and answer, and then we will have Vicki walk through the answer, the response. And I appreciate everybody's reactions. Yes, this session was meant to be hilarious. And so I'm glad that that's resonating with you all.
And we'll give that just about another 15 seconds, just make sure everyone, oh, actually it looks like somebody ended it early, so I apologize.
No worries. All right, here we go.
Okay, awesome. Yes, the correct response here is that Emily may enroll into ESRD at a later date and can keep the marketplace plan. We look at this option, especially if they've already met the out-of-pocket costs with the marketplace plan. They may have a tax subsidy that makes it very affordable for them. Remember, not everybody on ESRD is receiving Social Security disability income. They may not be receiving their early retirement yet. So a lot of people, if they're having major health issues, do need to have a little bit of consideration into their costs. But I do want to step back. As for number 1, since Emily already has a marketplace plan, she can keep it and work with Medicare and they'll coordinate. Well, the coordination part doesn't exist. That puts us back in the olden days when we used to have to submit our own claims to the secondary coverage. And as well as the loss of the tax credits. And we know that happens as soon as a person takes Medicare Part A and or Part B. And I don't have all my questions. Yeah, where are all my questions? But the third one was the right choice. That was the right choice. And the other ones, there's too many issues, the loss of credits and the inability for coordination of coverage. And as for flipping a coin or rubbing that crystal ball, I swear that's what a lot of people do when they're talking about Medicare. They really don't know what to do. So they go with their best guess. And sometimes they're right and sometimes they're not. And that's when we come into play. Thank you.
Yeah, thank you so much, Vicki. And I think we're just at time. So I want to just zoom through resources that you can look through. We have our navigators that are a resource to anyone in the state providing enrollment assistance and can help answer your questions or at least get you to the right place. We also have many ways to reach us through the Get Connected coverage tool, as well as our chatbot, which I think has been highlighted a couple times, and our, of course, direct phone numbers. And then I want to just let Vicki and Kate just share where you can find them or their colleagues to help you with Medicare.
Well, I can go ahead and let you know, as you know, I am supervisor of the Medigap helpline at the Board on Aging and Long-Term Care. We do have a designated email helpline that you could email, and you could just say, hey, Vicki, and I'm the only one there with Medigap, so I will get the email. We do have a webpage that we just launched this year. I still had some updates to put into the webpage, but that's also another good source of information. Or you can contact our toll-free line, and this is toll-free anywhere in the United States, 1-800-242-1060. And Kate and her benefit specialists and ourselves, we work very well together, and we do refer people back and forth where appropriate. Thank you.
Yep, and I'll just say, please refer people with questions about Medicare to the ADRC, Aging and Disability Resource Center in their county. That's very important. I'm happy to answer a question from a professional or someone watching this if it's a quick question, but please do not refer consumers to me. I actually train ADRC staff, and I don't actually work directly with consumers myself, so please do not refer them to me. Refer people back to the Aging and Disability Resource Center. There's an elder benefits specialist who works with people 60 and older and specializes in Medicare. And there's a disability benefit specialist who works with people 18 to 59 with questions about Social Security, disability, and Medicare.
Wonderful. And then this is just a nice resource that's provided by the Centers for Medicare and Medicaid Services that actually talks about Medicare and the health insurance marketplace and how to kind of navigate between the two programs that I wanted to make sure that people had access to. Finally, I think we got to the end of our session. I'm very thankful for both Kate and Vicki and all that you were able to share with us today. And I hope you all have a wonderful rest of your day and a wonderful next session. And I'll transition it back to Allison. So thank you so much.
Super. Yes. Thank you so much. What an enormous amount of content. So thank you both, all three of you for leading us through that. Yes, we have another session starting promptly at 10:45. So we can take a break now and we'll see you back in 10 minutes. Thank you.
Thank you very much.
Yep, thank you as well.
Welcome back, everybody. We're going to go ahead and get started. And I'm really pleased to introduce our next session and our next session moderator. We have our panel of leadership from qualified health plans in Wisconsin. And the moderator is Julia Garvey. Julia is a longtime navigator in Wisconsin, and she is based at Partnership Community Health Center and is also a longtime partner of covering Wisconsin, clearly in her navigator role, but also in her role in helping to lead the East Central Enrollment Network. So, Julia, I'm happy to hand it over to you for our next session.
Good morning. Hello, everybody. And let's all start by crossing our fingers that I maintain a stable internet connection. I've been getting these frightening little pop-ups throughout the morning, hoping that we stay connected. And if we don't, Jen Ball is in the background who can keep the ball rolling, pun intended. So thanks everybody for tuning in. This has always been one of my favorite sessions, and I'm very happy to lead this today. Helping consumers see and understand plans that fit their budget and care needs with so many plan choices, I think is one of the most challenging aspects of the work that we do. And as proof of the strength of our Wisconsin marketplace and our plan's desire to engage with you and their members, we have a record 7 qualified health plans participating today. With the opportunity to hear from so many plans, the format will look a little different this year. Each plan will briefly share key highlights for 2023, but the bulk of our time will be spent on deep dive questions that will enrich our work. So we're going to hear from experts, and I'd like to introduce you to the participating qualified health plans and their presenters as a group. And then you'll hear from the individuals as they touch on their key highlights and answer questions. So welcome to Coreen Dicus-Johnson, the President and Chief Executive Officer from Network Health. Angela Vinson, Broker Relations Manager at Quartz. Marty Anderson, Chief Strategy and Business Development Officer at Group Health Cooperative of South Central Wisconsin. Danielle Coterel, Director of Product Development and Sales for Chorus Community Health Plan. Jennifer Walkowiak, Vice President of Business Development at Common Ground. Fabian Guardarrama, Director of Sales for Molina Healthcare. And Paul Nobile, President and General Manager of Anthem. And we're going to start the overviews with Coreen.
Good morning, and thank you for having me here. Just a couple of highlights about Network Health. We're excited that we'll be celebrating our 40th anniversary this year. We've always been provider owned. Our owners are Freighted Health System and Ascension, Wisconsin. And our focus is always about our members and making sure that we are putting them at the center of what we do. Our mission is to build healthy and strong communities, and that's one of the reasons we participate in the ACA. A couple of things to note. Our service area has 9 counties in southeastern Wisconsin. It's Washington County, Ozaukee, Milwaukee, Waukesha, Racine, and Kenosha. And in Northeast, we are in Calumet, Outagamie, and Winnebago. One change for this next year is that we will be exiting 2 counties, Waushara and Waupaca. So if we can go to the next slide. Our focus for 2023 is really about stability in the plan offerings. And so we have very few changes for 2023. Our average increase this next year is a little over about approximately 5%. And our new plan that we're offering is the Prestige Bronze Plus plan, which covers the standard benefits. Another change from this year is that we're reducing the number of our formulary tiers from 6 to 5, and this will basically combine our generic and adherence generics into one tier. And then launching our insulin patient assurance program that will have caps for co-payments for 30-day supplies. These 30-day supplies will be available both in-store and also through Express Scripts, which is our mail order. So these are some highlights, and I look forward to later to address specific questions. Thank you.
Thank you. Angela?
Well, good morning, everybody. My name is Angela Vinson, as Julia had introduced me, and I'm the broker relationship manager with AC on and off the exchange. So my whole job is to train our brokers and our external partners on everything Quartz. So I appreciate the opportunity to speak with you guys and also give you some high-level overviews on what Quartz has for 2023. Next slide, please. So we actually have a lot of exciting new benefits that I want to talk about for 2023, similar to Network Health. So what Coreen had shared, we are also a provider-owned organization. We are owned by UW Health, Aurora Health Systems, and Gunderson. So you'll see on my map here, it's a little bit small on the side, but we are in a pretty large footprint. So we don't just service Wisconsin, we also have benefits in Minnesota and Illinois, although I know today this Wisconsin, the benefits we're talking about today are specific to Wisconsin. We have not pulled out of any markets for 2023. We've expanded into 1 new county. Way on the top of the slide, you'll see Florence and Purple. That is our new county that we're servicing. But we have some nice enhancements, hopefully to give the consumer a more predictable cost share when experiencing benefits with Quartz. So we have added for this year copays for lab and x-ray. We've lowered our copays for primary care and specialty. We're adding a new value tier RX. Most of our plans in 2022 had 4 tiers. We're adding a new 5th tier, more cost-effective benefit for that 5th tier level for our consumers. We're adding the buy-up option of adult vision, which includes hardware and contacts. We're adding new 0 deductible plans on and off the exchange, as well as adding a specific platinum plan for off the exchange direct to consumer. And we've enhanced our HSA plans to add an embedded deductible. I as well appreciate being included today, and I will look forward to also having more specific times to answer questions. Thank you.
Thank you, Angela. Marty?
Good morning, I'm Marty Anderson with Group Health Cooperative of South Central Wisconsin. This is not my first time participating, and it's great to see 7 plans participating in this conference from throughout the state. I believe that competition is really good for consumers in the individual and family market. I remember years where we were worried about having particular counties covered with any carrier. So to have such a robust participation is wonderful. Group Health Cooperative has been serving the greater Madison area for 46 years. This is our 46th year in business. You can see our individual and family plan footprint on the screen. So we've got a 12 county service area in and around Dane County. We are reducing our service area by 2 counties this year. So Vernon and Richland County in the southwestern part of the state will no longer be within our service footprint, primarily due to provider network adequacy regulations. So want to make sure that consumers have enough providers to meet their care needs. Group Health Cooperative has two products that we offer in the market. We've got our Select plan that we offer in Dane County only. In that product, it is the 6 primary care clinics owned and operated by Group Health Cooperative that are the major primary care providers. In our HMO plan, which covers all 12 counties, that is our broader network that we offer. The GHC Select plan is slightly less expensive than our HMO plan, but both are very competitive within their service areas. In terms of things that are new for 2023, we did expand our primary care footprint last year in our HMO plan that is inclusive of now UW primary care clinics throughout the area. In addition, we have now expanded our eye care partnership with Isthmus Eye Care. So that's another eye care provider that will be offered within our network going into next year. We've also expanded our mental health benefits, mental health services through our own clinics, through the GHC Foundation's intensive outpatient psychiatry program that opened up last fall. We just opened up another component of that just a couple of weeks ago. It is a great program for people that don't want to travel outside of the Dane County area. Last but certainly not least, we also are now including the Member Owner Rewards program as part of GHC's offering. So that packages together many of our value-added services into a single offering for across all of our product lines.
Thanks, Marty. Danielle?
Good morning. Thanks so much for having the opportunity to be here with you all today. My name is Danielle Coterel. I'm the Director of Product Development and Sales with Chorus Community Health Plans. This may be the first time that many of you had heard our new name. You've known us as Children's Community Health Plan since we launched in 2006. Many of you have also known us as Together with CCHP, which is our individual and family plan, which we launched in 2017. And collectively now, though, we are all Chorus Community Health Plans. So we'll show up on Marketplace as such. And good news is you can still refer to us as CCHP as well. We can go to the next slide. So today I have the pleasure of sharing some information about our organization and our individual and family plans on and off the exchange. We are in a 15-county service area in eastern Wisconsin. Our new changes really specific to our plan focus on our values of collaboration and health. So really important for the consumers is that we're going out with a very minimum premium increase this year, less than 1% across all plans. We are broadening our provider network. We'll be expanding into Sheboygan, and we'll also have contracts with HSHS and Prevea. So we're really excited about that. We are offering some new plan offerings, including a silver copay, which is a $0 deductible plan, very similar to our bronze offering, just a new metal tier. And we're also offering a new comprehensive child, but preventive adult dental plan option. So that's in addition to the other two standalone dental plan options that we currently have off on and off the exchange. And then lastly, I would just say it's important to mention the things that aren't changing that make CCHP who we are. Continuing to focus on those extra benefits and member-centered care, really trying to make sure that outside of the provider's office, members have what they need to make sure they're healthy and well. So continuing our SDOH work, $0 preventive visits, select medications, including some insulins, then offering free telenutrition visits and other programs and services I'll go into a little bit later. Thanks so much.
Thanks, Danielle. Jennifer?
Great, thank you so much. For those of you who are expecting Kathy Beathy, I'm sitting in for her today as she is celebrating a recent new addition to her family with a new grandchild. So I feel honored to take her place. I know she's been part of this QHP panel from the beginning. We at Common Ground have been part of ACA from the very beginning, and we just celebrated our 10th year as an organization. Some highlights for 2023. We're going to continue the great benefits and coverage that you've seen from us in the past. It's going to be the same service area and network as 2022. Will be all of eastern Wisconsin, 25 counties, which will include the health systems of Advocate Aurora, Bellin Health, Children's of Wisconsin, Dickinson County, Door County Medical, Beta Care, Watertown Regional Medical Center, and a number of independents. We are also continuing the additional coverage of our adult vision and allergy testing. We will continue preventive dental that will be available in the southeastern Wisconsin, ratings areas 1, 9, and 12. They will not be available on all plans, so it'll be select plans, and we can go into a little bit more detail in our training. One great thing that we've done this year is we've really simplified our plan names. So as you're working with individuals and trying to get them to understand the different plans, our new names will really help guide you in that process. We will have all of the new standard plans, which you've heard, that are part of this year. And we'll continue to have the dedicated team that will service you and your clients' needs when questions arise.
Thanks, Jennifer. Fabian?
Good morning, everyone. And first off, a small shout out to Julia for doing a great job with my last name. So my last name is Fabian Guardarrama. I'm the Director of Sales for Molina Healthcare. We're in several states, all from the East Coast to the West Coast. We've been around since the very beginning as far as marketplace is concerned, and we do value assisting members to get coverage not only with Molina but with all the great other carriers that are on this call. So just a few things to highlight, and it's not so much this year. There's not going to be a lot of changes with Molina specifically. We're still going to have a silver and a gold plan. We haven't changed our footprint, and we haven't reduced our footprint either for this coming year. So first of all, no cost benefits wellness program with our My Molina perks that includes incentives for targeted health activities, free teledoc, low and no deductible plans. We do have our 24/7 nurse advice line, and also plans for purchase with no cost adult vision services. We do focus on supporting unwinding efforts, and a lot of the stuff that we're going to have this year. We are going to have 3 trainings this year, and you'll see the training dates at the end of the presentation. And if you need additional assistance, you'll see the email address that we have, and you could call our member services at 888-999-2404. So I want to thank you everyone for inviting me, and back to you, Julia.
Thanks, Fabian. And Paul? Paul, if you're there, we may need to unmute, or you may be having internet problems as well. Mike, how about if we pull up the first poll question, because we can go to that?
Yep, absolutely. We'll give just about 30 seconds for this question. Paul, while we have the poll question active, I would just go ahead and just double check that your audio settings in Zoom are the same as your computer. Sometimes those can get disconnected.
And as you've all noticed, we've just given like 2 minutes per qualified health plan, where I'm sure they'd love to have 60 minutes to share their news. So our question to you first off is, would you benefit from hearing a more in-depth overview from the QHPs in your areas? And that will answer some of the questions I'm already seeing in the chat that would help you hear more about the health plans that are in network with their plans. Let them talk a little bit more about how they work with their members and their social determinants of health. So take 30 seconds here to answer the question about whether you'd like to hear more time spent on an overview for the plans in your area.
And Paul, if your audio is still having issues, you can also call in as well. That will allow us to hear us. The audio won't be as good, obviously, but it may be a short-term solution just in the interim.
And Paul, you've got a couple of minutes before we get to your first question, so you can work through this audio issue. Great. Thank you for everybody for answering. Again, this was a real short overview, so we can move on to some in-depth questions. Mike, why don't we go ahead and move on forward? So each one of these questions is designed to kind of really give us a deep dive. These were contributed by agents, enrollment assisters, navigators, certified application counselors, who all have these concerns in the work that they do. So for the first time this year, qualified health plans are required to offer standardized plans at every level and throughout every service area where they offer a non-standard option. Could you talk us through some of the differences between your standard and non-standard plans, and what additional benefits or features would be included in a non-standard plan that we can look for that set them apart? Go ahead, Angela.
Okay, thank you. So for standard plans, Quartz has been in the industry for ACA since the beginning as well, so for 10 years. So, back in the beginning, the Affordable Care Act required us to have standard plans, and again, they brought them back this year. So we haven't had them for a couple years, but we understand the reasoning for them to do a true comparison from company to company. Our general plans have a lot of extra benefits that the standard plans don't. The lab and x-rays being added is a differentiator. The standard plans don't have a lab and x-ray copay. We also have the value tier, RX, that is also available on the non-standard plans. We're not allowed to put it on there. We also offer the addition of the purchase up on dental and vision. We've had dental since the beginning as well. It's a product built into our medical, but it is an additional cost. And then we also offer a virtual visit. So the virtual visit on our non-standard plans allows the consumer to go to a primary care provider, behavioral health provider, or urgent care provider, in most cases at zero cost. So that's a big differentiator between the regular plans and standard. And then again, what additional benefits are featured? Basically the same as what I just mentioned. You're getting the lab and x-ray, you're getting that separate tiering for the pharmacy, the dental and vision buy-up option, in the virtual visit. We do have a wellness benefit that's available on all of our plans for just being a Quartz member. It's called Quartz Well, where we do incentivize our customers and members to earn up to $100 a year for healthy lifestyle. So that's available on all of our products. That's the same on standard and non-standard. Thank you.
Thank you. Coreen?
So I'll focus on the differences in our non-standard plans. First thing is that we offer many plans that have primary care office visits with no copay. Our vision benefits are through iMed, and we offer several covering annual vision exam and a $100 allowance for glasses or contacts. Our dental benefits are through DentaQuest. They include an annual dental exam and a bite wing x-ray and cleaning. Our wellness program is our Momentum Health Rewards program that offers members and their spouses a $100 gift card for completing 4 essentials for their health and wellness. And those essentials are completing things like your health risk assessment, getting a flu shot, getting a wellness exam, and then also designating a primary care physician, because we really want to emphasize that relationship. The Wellness Beats Fitness program offers on-demand fitness classes, nutrition demos, and goals-based challenges and fitness assessments. So those are some of our non-standard plan features.
Thank you. Marty?
So Group Health Cooperative of South Central Wisconsin, outside of the cost sharing on the standard plans, really treats the standard plans and our non-standard plans the same. So you get the same great benefits that you would get in our standard plans as our non-standard plans. Obviously, the standard plans are now coming in at the lower end of the actuarial value spectrum, and it's a great opportunity to do a head-to-head comparison for the navigators and the assisters out there to really see the pricing differential for a similar or a like benefit package. We do offer in our non-standard package, though, similar to Network Health Plan, what we call our primary care preferred plans. Our primary care preferred plans have no cost sharing for any of our primary care services, either within the GHC clinics or within any of our primary care contracted network providers as well. So that would be one of the key differences. There is not a primary care preferred plan offered in the standard option.
Thank you, Marty. Do we want to take a little sound check for Paul now before we move on?
Yeah, Julia, can you hear me now?
Yes. And if we can go back to Paul's slides and give him his overview.
Okay, yeah, I'll be real brief. Thanks, Julia. Yeah, if you hit the next slide. Yeah, couple quick updates, some exciting things for Anthem. First off, both are network related. So first off, the pathway service area is the existing footprint that we operate in. The kind of the enhancement and the exciting news is that we've added Pro Health to the network. So an enhancement to the product offering that we have today is adding Pro Health into the network. The footprint that we operate in under pathways has not changed. So that's good for those in Southeast and what we call the cow counties, Calumet, Outagamie, and Winnebago. And then if you get to the next slide, I think the big news for us is we're going to be offering our Blue Preferred network, which is our broadest statewide network, will be available in 68 counties. It will be included in the counties in Southeast as well. So if you're residing in, say, Milwaukee or Waukesha County, you'll have an option of the Pathway network, or you can also select the Blue Preferred network, which is our broadest network offering available. And again, we're going to be available in 68 counties.
Great, thanks. I'm glad you got on with us. And we can move on to question number 2. Over the past couple of years, a number of the qualified health plans have introduced plans with 0 deductibles and then the maximum out-of-pocket limit. Do consumers understand the pricing structure in these plans? And I've kind of always described them as like an a la carte menu. I hope that was a good way to describe them, and they took a long time for me to understand how they worked. So what type of consumer are these plans most cost effective for? And are consumers who are enrolling in these plans without the assistance of a navigator or an agent or a certified application counselor understanding how these plans are working for them?
So I think I'm up first. I think they actually do, because what's the benefit of these particular plans? It's a sum certain for certain types of services. Typically, you see these in Medicare Advantage plans because it's very easy for individuals to navigate. You go to your primary care, you're going to pay an X amount. You specialty visit, you're going to pay X amount. So we have found that these type of plan designs are very consumer friendly because it's clear about exactly what an individual will pay for the specific type of service that they will receive. And moreover, I think the proof is in the pudding for us at Network Health, because in 2022, this was our most popular health plan in terms of growth, because of the simplicity of having a flat dollar amount for those particular services. And we would also say that it's for what we've seen is that the kind of those bridge individuals who have retired early, they're too young for Medicare Advantage, really like these plans. And we've seen a tremendous amount of growth in them because they're very similar to what they're going to see in Medicare Advantage in terms of specific cost amounts for particular services. And so we've seen an increase there. We're going to be offering them again in 2023. And it looks like, based on some of the overview we've seen, that the popularity of these programs is pretty robust, because it looked like to me that pretty much all of the health plans are going to be offering some type of plan that's very similar in that regard.
Great. I think I'm up next, and I agree with what Coreen had said related to the early retirees. As far as consumers, that this would be a really good plan for is those who are most likely low to medium low care users and are primarily being seen by only a primary care physician. They kind of understand that the value of kind of they're paying a certain dollar amount. However, what we've also heard from a number of our members who've had these types of plans is it's really important for them to understand that copays do vary by service, and to understand those specific details. These plans aren't right for everybody. And those that are buying on price, it might not be the right plan for them. It's important to understand kind of what their utilization is and where those costs may come from. while they have immediate coverage without having to pay the deductible, they may have more co-pays than they're used to seeing, or an expense they're not, they haven't had in the past.
So as far as this question, health insurance can be confusing. And at Molina, we recognize insurance speak needs interpretation and ongoing education. We're always reevaluating ways to better assist Molina members. One thing about this line of this product line, as far as marketplace is concerned, and to piggyback off of Jennifer, there's really not a one-size-fits-all product out there. And when I say product, also on the carrier side, you really do have to assess the member's needs and make sure that that is being identified for that person. I tell people all the time, even family members, make sure that your plan really does fit, whether it's on a provider side, whether it's on the product side or pricing. Make sure that the product is the best fit for you, regardless if it's Molina, Common Ground, or any of the wonderful carriers that are out there. Some of the things that we do, Molina's customer service center has a very knowledgeable staff to help out members understand their coverage and answer any questions. We recently updated our marketplace website to make it easier to navigate and get fast answers 24/7. Throughout the year, Molina sends regular member communications, reminding people to take advantage of the preventative services that are part of their membership. Molina has My Molina online portal where they could review claims, and I think that is something that needs to be stressed at the point of application. I think that it really empowers the member as far as their healthcare.
Thank you, Fabian. Thank you. I'm sorry to interrupt. We're going to move on to the next question, please. Enrollment assisters use plain language and examples to help consumers understand health insurance concepts and potential costs. What steps are you taking to help improve health insurance literacy for your members around their plan benefits, provider network, care costs, and paths for problem resolution, both in terms of written materials and through member service interactions? And in what ways do you engage, as Fabian was just indicating, and communicate with enrollment assisters via maybe newsletters or trainings or access to a broker line?
Thanks. It's a really good question, and I'll do my best to answer it quickly. We know that obtaining health insurance is just one piece of this journey, right? People actually need to be able to use their care too. They need to be able to go into the doctor, get care when they're sick, all of that. So we try and educate our members before they even become members, so they know what they get when they're choosing CCHP. We work really hard every year to review all of our materials, to update our information on our website, make sure it's very robust. So people have information on our policies, our benefits, our network up front, and they're making a well-informed decision to choose us. We really try and connect with our members in the community as well. We've been in the night market. We've been at a couple of different community festivals, other street fairs and farmers markets and things of that nature. And really it's just a way to build trust. So people know when they're calling us, they're speaking with Beth or Christine or Andrew, and now they've met us, and they're more apt to give us feedback that way too. We obviously can't meet everybody in person, so we send satisfaction surveys both to our brokers and to our members, asking for their feedback and trying to identify opportunities to improve upon, to build on the things that we're doing well. And then I would say one of the most important things that we also do is really try and train our customer service teams, and then we have a really good feedback loop with them. We have call calibration sessions. So we're listening to calls that customer service reps have had, trying to improve upon the great care that they're providing. I think we probably all have a shared goal here. Like, we want to make sure that our members are informed and understand their coverage and use it the best they can.
So Molina values the work that enrollment sisters provide. Molina has a dedicated member engagement team, direct email to expedite answers to questions you have during open enrollment and throughout the year. Offer annual virtual training sessions for enrollment assisters in October. Also, Molina has a reference brochure for enrollment assisters to provide a list of hospital systems that's regularly updated. Also, FQA, federally qualified health centers in the Molina Marketplace provider network. It can be emailed to enrollers, to all of our enrollment assisters upon request. We also send periodic, well, I can't even talk today, emails and hard copies of Molina Health Plan information to enrollment sisters who request Molina Health Plan specifics.
So Group Health Cooperative really took an inside-out approach to this, and we created a health literacy work team internally here at the cooperative. And really, they're identifying any issues that our patients and members might have in interacting with the healthcare delivery system or as us as a health insurer. So they're actually they work and they train our staff internally on health literacy concepts so that we're communicating with our patient audience most appropriately. In addition, they review all of our materials to ensure that they are easy to read and understand and accessible for folks. We also offer a free internal language services, multilingual internal services. So if anybody does not have English as their preferred language, we're able to help them and help them understand their benefits. That's also embedded within our member services team. We have a bilingual individual that's answering phones there as well. And then if folks need alternative ways to access group health cooperative information, we're able to provide it in Braille. We have qualified sign language individuals that can provide information in that manner. And then for the navigators and the assisters, they can always reach out to our member services team. Member services is on the phones from 7:30 a.m. till 5 p.m. and you can reach out with any question. It's amazing. I sit with them once per month just to hear what our members are saying about Group Health Cooperative, and they answer every question from A to Z. So I'm sure if you reach out to them, they have heard your question multiple times before.
Thank you so much, everybody. Next question, please. Households with medium to high incomes frequently choose plans with low, higher out-of-pocket costs like deductibles. Fearing the cost, and I'm talking about this Alice group of people whose incomes might put them over cost sharing, but it doesn't mean that they're wealthy. And everybody's resources are stretched days. People often postpone primary care, potentially resulting in poor health care costs. How can enrollment assisters better explain these care costs to consumers and help them make better choices that are more aligned with their expected care usage? And then in what ways do you train enrollment assisters about plan design so that we can speak with confidence about the plans that you offer?
So when talking to households with medium to high incomes, their current health situation will be key. For the most part, people that are healthy will gravitate to the lower cost premium option. Not only in the state of Wisconsin, if you look at it nationally, that is the case. Regardless of their maximum out of pocket, your member they'll gravitate more and focus in on the initial cost of the premium when they're currently healthy. The one thing that I'm going to stress, and especially with in regards to when that person first enrolls, is really stress preventative care. It's free. I would encourage them to do that in the first 3 months after they signed up, as far as their coverage is concerned. Also, Teladoc is free for the member. So as far as initial costs are concerned, that will put that person at ease when they first get their coverage. Lastly, encourage members to use member portals like my Molina, for example. They're going to be able to access their information quick and really be on top of their healthcare.
Great. It's kind of to add to that, one thing that I think as navigators and enrollment assisters is to really understand, help the member or the individual understand what it means to have these higher deductible plans and whether it's appropriate for their situation. And they can do that by walking through kind of common unplanned illness and injuries like a sprained ankle or a diagnosis of strep throat. Can they handle a $600 unplanned expense? If not, maybe it's more appropriate for them to look at maybe not a bronze plan, but look at the silver plans that have some cost share. They'll pay a little bit more for premium, but they'll be covered when something unexpected happens. From a standpoint, how Common Ground kind of works with our enrollment assisters and navigators is we have a navigator line, an email box, as well as a phone line that's available all year long. So if you have members that do come in with questions, we encourage the enrollment assisters and navigators to reach out to us for us to help answer those questions. We also provide plan design webinars to enrollment assisters, and there'll be more information later during this presentation with how you can enroll in those trainings. We'll be recording those trainings as well. So if you're not able to attend the actual webinar, we're happy to send out in a recording of that actual training.
Yeah, Julia, hey, it's Paul. Really good question. I think it's important to understand that, consumers, they can obviously select those low premium plans that have higher deductibles, like an HSA compatible plan, but they can still get access to benefits before their deductible and out-of-pockets kick in. So, it's important to note that, and I'll emphasize a little bit what was said, members should not postpone care. In particular, they should understand how to utilize these benefits. They're there for a reason. There's very low, or in some cases, zero member cost share for things like preventative care visits, preventative screenings, vaccines. So as an enrollment assister, what I encourage you is to, if you're guiding individuals to a lower premium plan, because that's what they want, make sure there's an awareness around some of the low cost benefits baked into those plans, even though they have high deductibles. There's very low or zero copays on PCPs. Select drugs, a lot of them are $0 or low copays for tier 1 drugs. Virtual visits, $0 cost shares. The other thing that I would encourage you to do is really just start a conversation with the person you're talking to. Try to understand their needs. Is their doctor in the network? Are they willing to change their doctor to buy a lower cost premium? Maybe so, maybe not. What health conditions do they have? What medications are they taking? Those are things that should be considered when selecting a plan. Their overall financial situation. Can they weather a situation where they have a high deductible plan and they have a impact of a higher cost? Things like digital competency, right? Are they competent in accessing telehealth or virtual care? Because again, in many instances, those are zero or very low cost. The last thing I would do and emphasize, regardless of what product you have, preventative care is critical now more than ever. And again, those are typically zero or very low cost. So I'd focus members on getting preventative care as early as possible once they have their insurance.
Thank you, everybody. Great answers. And this is, if you'll pause there, Jen, and go back one, this is our time for our second poll question. That question really kind of teed up this poll question as soon as that can pop up. There we go. Would you benefit in your region for a deep dive into plan design from the QHPs in your service area? I'll share with you that I started this work, I believe, in 2014, and the hardest thing in the world was to understand at the end of that Healthcare.gov application how to look at plans. And we were very lucky through our regional enrollment network to be connected with several agents who held our hands for years and helped us understand plans. And since then, we've learned that the plans are also really willing to sit down with you and share their plan grids, talk to you about which plans have embedded deductibles or separate pharmacy deductibles, or let you ask questions like a fifth grader, because that's the way we all feel when we start looking at plans. So thank you for your willingness. If we've got answers, I think you'll see the interest in that everybody has in understanding plan design. Yeah, overwhelmingly. I think it's the hardest part of our job and the thing that we need to be really good at. It's also a nod to understanding and having relationships with the agents in your area. And I'm also teeing up a session tomorrow in which Sandy is going to help us walk through a scenario very similar to this and show us how she helps consumers with incomes over cost sharing to look at plans and make good choices. Thank you. All right, let's go to our next question, please. Throughout the COVID-19 public health emergency, Medicaid has allowed telehealth to be a billable service for behavioral health counseling. This has created tremendous interest and access to care for those who can find a counselor in their area. Does your qualified health plan cover telehealth for behavioral health at the same copay as an in-person visit, and will you be promoting this service? And part of this is that I was trying to look on the qualified health plan websites for a certificate of coverage or some type of information on the website to help me understand the answer to this. It was very difficult to find. So if you could combo that answer together.
Yeah, a couple of things, Julia. It's Paul. Yeah, so number one, yes, out-of-pocket costs for behavioral health services are the same, whether they're in the office or virtual. On all plans except the HSA compatible plans, virtual behavioral health through our preferred vendor, which is Live Health Online, are free. Okay, so it's important again to emphasize the fact that there's a lot of really good rich benefits and availability for people. We do promote access to virtual care through an app that is called Sydney Health. It's an app and it provides access to virtual virtual care for behavioral health and other medical conditions. Members have access. There's personalized tools to compare and contrast cost and quality between providers. And even pre-pandemic, obviously now more than ever, getting access to behavioral health has been a challenge. And so using it virtually is important. The other thing that we found is there are certain stigmas tied to social determinants related to getting to appointments, so transportation, barriers like time, getting time away from work. And then there is the social stigma tied to behavioral health that needs to be addressed and overcome. So virtual care is one way to do that. Julia, to your other point relative to it can be very complicated what is covered under the certificate of coverage. It's it's a lengthy document. We obviously recommend everybody review it carefully, but sometimes that feels like it's overbearing. So what we would refer to you is look at summary of benefits. It's a really good place to start, specifically focusing on the covered services section and then the exclusions and limitations sections. Those are the areas that I would really call out. And then if you can't find the answer to your question there, and we'll share this at the end of the presentation, Anthem's created a designated or dedicated hotline and website specifically to you all. So we'll share that information at the end. But hopefully that helps.
So there have been a few silver linings to the pandemic, and I think one of them is the greater usage of telehealth and virtual care. From our perspective, it's faster, it's more convenient for the patient and the member, and it's more efficient from the provider side of the equation as well. So I think that's been great, and we've adopted that even before the pandemic, as Group Health Cooperative has had our GHC Care on Demand app, and that is both for what we'd call tele-urgent care services as well as behavioral health services. So people can seek those services through our Care on Demand app. In addition, we do not treat any behavioral health in-person versus virtual cost sharing differently. It is the same cost sharing if you're in person or if you're seeking those services virtually. And that's the same across all services that are provided virtually. So when you're thinking about Group Health Cooperative, it's fairly simple. If somebody is receiving those services in a virtual manner, they're going to be covered the same way that they would be covered as in the in-person manner. Yeah, I think that's where I'll leave my answer.
I would agree. The same thing for CCHP as well. I think most providers will add a modifier to their claim, so they allow us to differentiate where the service was provided, whether it's e-visit or telehealth or some other remote setting or in person. We're reimbursing the providers the same, and we're also ensuring that the members have the same cost sharing. So whether that's co-payment or co-insurance, it really just varies based on their plan. Also agree that the EOC can be difficult to navigate. The schedule of benefits and summary of benefits and coverage is a smaller document, a little bit easier to read through. We've added at CCHP a separate section to our website because everything was, changing and uncertain. During the pandemic and even now a little bit, we've added a special COVID-19 section. And so we add any updates and communicate changes there. We also use member and provider newsletters to make sure that everyone's staying abreast of any of these changes as best as possible anyways. And then we provide our customer service with talking points so they can answer consumer questions. The other thing that our customer service does is if a member calls in, they'll actually call the provider to check with Ascension or Freighter to fill in the blank to see if there's specific telehealth services that they offer. And then they'll work with a member to set up those appointments on the phone. And then our customer service will also provide information about CCHP on call to our members. And so that's a service we've had since we launched in 2017. It's a free and unlimited service to members, and it allows them to connect with a nurse line and then also connect with doctors that can prescribe medications for certain common conditions. And so we encourage the use of that as well as telehealth. I think really we all have the same goal, is to get members the care that they need in the most comfortable of settings. And so I'm trying to continue to effort towards that as well.
Thank you so much. That's probably one of the #1 requests, especially from young adults who call and ask to get connected to insurance, is they want to see a counselor. And it was my great fear that their comfort in being able to do that through Medicaid over the phone would transition in a way that would be more difficult for them to access care. So thank you so much. And can I make a personal plug for enrollment assisters? The QHP websites are a wealth of information, and I have them all kind of quick linked on my desktop. And you might want to spend some time poking around to find, for instance, this certificate of coverage, which I didn't know existed until, again, my agent friends shared with me what that document was and how to use it. And in any upcoming trainings that you might get from your qualified health plans, I'm sure they'd be happy to show you more about what's on their website and how to access it. Thank you, everybody. And let's go to our final question, and then we're going to have time for questions in the chat, and then we may even open it up for kind of a speed dating session with all the plans so that you can answer any questions that you didn't have posed to you directly, because we're moving ahead of our scheduled time. So a number of carriers in Wisconsin offer both Medicaid managed care and a qualified health plan on the federally facilitated marketplace. How will you be reaching out to members and connect them to a marketplace plan that meets both their provider network and their budget?
Thank you, Julia. This is a great question. So with Quartz, we have dedicated customer service that we, of course, think is excellent, just like all the carriers on the panel today. One of the things that we do have that might be a little unique is we do have like designated pods. So we have a dedicated customer service team for Medicaid members, as well as a separate dedicated team for ACA members. So when somebody calls into Quartz, they're going to be directed to those teams if they're existing members with us already, to give them that higher level of customer service, as well as we have something called Quartz Champion. We launched a new product called Tiered Choice last year, where it's different tiering of our providers. And we basically created this newer part of our customer service called Tiered Choice that really gives them like a concierge type service and walks them through their providers and explaining their benefits in detail. We also have obviously a dedicated renewal team within customer service that walks through with every member that calls what their renewals are like. One of the things that we have been doing when it comes to the Medicaid population specifically, we recently sent out a communication to have them update their contact information, specifically wanting to make sure that when we do send redetermination letters to them, that both us and DHS are going to make sure that we get to the people that we need to get to. That's really important. Obviously, we're like most of the carriers on the phone too, that we have a continued partnership with DHS and the state to make sure that we are marketing to the right people, whether they're Medicaid eligible or whether they're marketplace eligible. So, you know, some people are on that fine line where they're going back and forth. We want to make sure that we have a dedicated staff that can answer those questions within customer service. We do a lot of outreach. We also have tools on our website that are very user friendly. We have a specific member category that sometimes even gives people videos on the differences of what some of the benefits are and how they work. So we really want to make sure that those people are getting the answers that they need for the products they're looking at and in their budget.
Yeah, Julia, it's Paul from Anthem. I'll start by saying that, you know, this question is really important for us as an organization. We're I think the only carrier here that we serve commercial members, Medicare and Medicaid across the entire state. So we've obviously tracked very closely on what's happening. I would say this too, and I can't emphasize this enough to the assisters on the call. I mean, this is a once in a lifetime situation that we're going through relative to the pandemic. And then, you know, the end of the PHE and ultimately Medicaid redetermination. So I can't emphasize and like encourage you all enough that the work you're going to be doing over the coming weeks and months is probably some of the most important work you've done to date and maybe in future years. So it's vitally important that we create the proper safety nets and information for people so they could choose the right plans that are available for their individual needs. That's one of the reasons, frankly, why we expanded our offering, both in number of plan choices that are available, but also the geographic footprint and offering the Blue Preferred Network to 68 counties across the state. So we think that's going to hopefully meet a lot of expectations from an access perspective and consumer choice. As far as communication, a couple things. Number one, working very closely with OCI, DHS, and other regulators on understanding, how people are going to be impacted and how we can reach out to them. And we've taken some great lengths, I think, to try to create some dedicated resources. I think the conversation today is the starting point, Julia, really, to inform all of you what resources are available. And again, we're participating, I think, in some of the upcoming regional enrollment meetings. I know Justin Rivas in Milwaukee, and then Mike Rust we're lined up for them. We've reached out to all the other regional enrollment networks. So I encourage you to engage us on that topic. And then again, we'll share some dedicated information for you as an assister that you can utilize, both an 800 number as well as a website and email to get answers to your questions and follow up.
I think it's really important for all members to have coverage and have coverage in the right products, right? So, sometimes there's value in maintaining coverage with the same company. CCHP has a Medicaid plan and we have an IFP option as well. So we are working really hard to make sure that members understand what's going to stay the same if they continue on with us, and obviously what will change and what will look different. We know that members that stay with us as they move into the marketplace or the exchange, they'll continue to have access to some of the programs that I talked about earlier. We also want them to understand the differences in the networks, whether that's PCP is no longer a network or they have more providers in network than what they were used to. We want to make sure that we're very clear about the differences. So we're putting together a piece that's just about finalized that shows the differences in network, in benefits, in programs and services, really to try and break it down for members so they're as well informed as possible. We want to make sure that that's shared with all of our partners, with our agents and our brokers, our navigators and application counselors. We have a team of licensed agents within CCHP that will be able to answer questions and help navigate members through that transition. And then we plan on keeping close to all of you and all of our other community partners to be a resource and, the same shared goal of making sure that people have access to the right type of coverage and care. We're also staying close with DHS, OCI, and others to make sure that we're staying informed and we're doing everything that we can.
Thank you. And you're right, it's such a huge lift that we have. I'm trying to compartmentalize and focus on getting through open enrollment and hope there's not too much of an overlap between a potential unwinding and, but it's going to be a marathon from now until through the next couple of years as we're continually helping people transition from Medicaid to the marketplace and rolling back through into open enrollment. We've got a big job ahead of us all. And for our last question today, when the public health emergency ends, people who are no longer eligible for Medicaid will lose access to covered dental services that they've had through Medicaid. Does your qualifying health plan have dental coverage, or do you offer a separate dental plan? If not, are you considering expanding dental services to a broader service area? And are you considering expenses to include more than diagnostic and preventive services?
Great, I will start off. Common Ground currently does offer preventive dental services, as I mentioned earlier, in rating areas 1, 12, and 9, so Southeast Wisconsin. They're only on some specific plans, primarily silver plans. We are considering expanding that in the future years. But we would do more than just preventive. What we found is members are looking for a fuller package of services, not just the preventive care. So that's something that we're looking to do in the future.
Similar to Common Ground, we at Network Health have offered dental on several of our plans over the last number of years. And this year we'll be expanding our network. We offer, similar to others, some first dollar services. This is an area that is, quite frankly, very near and dear to my heart because oral health, I think, is so important to overall health. My daughter is a dentist, and she, through her fellowship program, worked in underserved areas. So Network Health is really focused on looking at broadening our approach to really kind of, if you will, reconnecting the mouth with the rest of the body in terms of healthcare services. I don't have anything to announce as of yet, but stay tuned. This is absolutely on our team's approach to expanding overall preventative health as well as oral health to the rest of the benefits that we provide.
Quartz actually has had dental coverage on all of our plans other than HSA and now standard plans. We can't add the dental, but we've had dental options on all of our plans since the beginning. Excuse me. And we partner with a local company in Madison called Momentum Dental. Even though they're regional, they do rent a nationwide network, a really good PPO. consumers with Quartz, when they purchase our plan, whether it's on the exchange or the marketplace, they will see our pricing with and without dental. When they choose our dental product, it gives a couple different special things to them. There is absolutely no waiting periods regardless of previous coverage. It offers preventive services, but it also offers basic and major comprehensive benefits as well. Day one, we do not care if they've had previous dental or not. We're going to give them all those benefits right away. So this is something that's available in our whole Wisconsin footprint. We have a lot of people that take advantage of this, especially coming from group plans. So we know, especially with this Medicaid maybe unwinding coming forward, that Quartz will be a nice option for them because they will have the choice to choose dental with us.
Thank you, everybody who answered that question about oral health care. And Coreen, if you have more children, send them to dental school, and everybody on the call, if you have kids, send them to dental school. There's such a shortage of hygienists and dentists in our nationwide, and especially in Wisconsin. Thank you all for answering our prescribed questions. I just want to make a nod to the slides that are going to follow, and I don't think I want to spend the time to show them all, are going to show you training opportunities and contact information for each of the qualified health plans. I want to encourage you all to connect with them either through the trainings that they're going to be promoting through Covering Wisconsin. We'll share those invitations when they get dates planned, or if they don't have anything that you can see right now, through your regional enrollment networks to get a regional discussion going about how plans look in your area. And I want to make a nod to that all qualified health plans are invited to participate in this discussion. They're not always able to make it to this call. And I know that there's a big hole in the Northwest and Central and even Southwest portion of the state. Again, I think that's a role that the RENs can play in inviting the plans that show up in your area to come and invite them to tell you more about their plans and look at their plan details. So maybe if we can come off the slides here, we've got enough time to kind of do a speed round for any of the health plans that would like to address a question that they didn't get to answer or have any closing remarks. And we'll go in the same order that we did. And I know this is catching you by surprise here, but I'm glad we've got this extra time. Let's start with Coreen. If there's anything that you'd like to leave us with before our time is done. We'll give everybody a couple minutes.
Yeah, thank you for the opportunity. I just want to first start off with saying that the work that sisters that you provide to our community is incredibly valued. You're really helping to change people's lives, and healthcare is exactly that, a way to ensure that we're increasing the healthcare literacy so individuals can feel empowered, not only to be able to get the right access, but to understand how the care that they're receiving will be covered under their respective insurance plans. So I just want to say thank you for everything you do. And that's why it's always really important for Network Health to support your organization and support the work. I would also like to just give a shout out to the fact that as a provider-owned plan, one of the things that really differentiates us is that we work closely with the physicians that are providing the care in terms of how we design our particular products and how we work to ensure that everyone has access to preventative care and getting that care early on, building that relationship with primary care. All of the plans here do a fantastic job, but we think obviously that we have a unique relationship because of our ownership structure and that we do a good job as that. And so we will work hard to not only earn the business and continue the relationship with those that honor us with choosing Network Health. And thank you again for all of your hard work.
Thank you so much. Angela?
Well, this is my first time participating. I know that, excuse me, Quartz has participated in the past, but this is my first opportunity to speak to this group. So again, I want to say thank you. Being on the broker side, I'm also often in the community doing trainings and doing events with our provider owners, with Aurora, UW, and Gunderson. And I hope that this just facilitates and hopes to grow that relationship with the sisters and navigators that help all of our members. I want to kind of mirror what Coreen said, that being a provider-owned organization, that's really important, that we're local. We've been here in the communities for a long time and wanting to make sure people understand that. One thing I just want to leave people with is that when I shared my updates for 2023, Quartz is really trying to make an effort to lower the cost that the consumer's experiencing when seeking care. We know that this has been the last couple of years have been really hard. We want people to utilize their preventive services, but also sharing that we're going to be lowering those costs for those consumers. So hopefully they will seek care and be able to have a life well lived. That's our motto. We really want our consumers and our members to have the best life and be able to experience that. And thank you for letting me participate. Losing my voice, sorry.
Someone get Angela a lozenge. Marty?
Yeah, so as a member-owned cooperative, it's really important for us that our members are in the right plans. And I think that's very much in alignment with who you all are as navigators and assisters throughout the state. I think I really like the way that Julia referenced the next year, that it's going to be a marathon as we're getting through open enrollment, as we're getting people off from Medicaid plans and theoretically into some marketplace plans. It's going to be really important that these consumers land in the right plan for them. And that means making sure that the providers that they need to see are going to be in those plans, that the cost sharing is appropriate. I was just re-looking at some of the questions, and there's the question about the bronze level plans and high income consumers purchasing those. The reality is that there's a lot of low income consumers that are purchasing those bronze plans, and they're not always the best fit for those individuals. So choosing on premium alone isn't necessarily always the right way, even though we definitely understand that these are very cost conscious consumers. So understanding how the plans operate, who the providers are, how the cost sharing operates, I think is going to be really important as we go through this enormous number of people that are going to be selecting plans over the next year and a half.
Thank you. And so again, for everyone in the audience, when the plans promote their trainings or overviews covering Wisconsin, will be sharing that information. The Regional Enrollment Network coordinators will be sharing that information. And if there's something that you'd like to hear from any of the plans in your area, we have all the contacts. Feel free to reach out. They've been more than generous with their time and sitting down at a table and letting us mark up their plan grids so that we understand, and asking really basic questions that help us do our work. Thank you so much for that. Danielle.
Sure. Thanks again for the opportunity to be here. I think it's a really good group. It's been nice to hear that we all kind of have these shared goals, and we want to make sure that people are covered and covered appropriately. I think we all understand how complicated things have been recently, right? And so are just really trying to work towards making it as simple as possible, even though it's health insurance and it's not. So I think ultimately, we're all trying to do the right thing. We at CCHP, we've made a number of changes the past few years before we were required to by the state or various legislation that has passed. And so, having those kind of connections and relationships with our members has really helped inform what we've done as an organization. And I'm proud to work there, and I'm proud to connect with all of you also, just to make sure that we're being clear and you understand our plans in order to help our consumers as much as we possibly can. So I think the last thing I'll say that's on the slides, we have a dedicated team of licensed agents, small but mighty. So we're always able to answer questions. We really rally behind making sure that we're problem solving things for our members. So please reach out to us. We want to continue to stay engaged, and just happy to be here. Thank you so much.
Jennifer.
So speaking on behalf of Common Ground Healthcare Cooperative, we want to thank you, all of you. Healthcare is confusing, and so is insurance, and the work that you do is so needed in the community. So we're a nonprofit, member-governed company. We have high member service that we deliver to our members, as well as you. Those are helping individuals find the right coverage. It's so important that the coverage meets their needs not just for now, but for the full year. And kind of echoing what Marty had said, it's not always based on what's the lowest price. It's really taking a look at what the other options are. Maybe for a few dollars more, they'll actually have more coverage and be able to receive more benefits right away by paying just a few more dollars more. So we encourage you to explore all the different options. And when you have questions, feel free to reach out. We're here to help support you.
Thank you, Jennifer. Fabian?
Yeah, for all of our sisters, congratulations if you've been in this business, have been assisting members for a very long time. It's been, best way to describe it, it's been a roller coaster ride. You have to keep up with everything that's going on, and I have to tip my hat towards each and every one of you. It's ever changing. This year, it's definitely different, and I bet you next year it's going to be different again. So congratulations on that. A few things that I didn't mention, a couple things I didn't mention during the during my portion of the presentation. First of all, I wanted to make sure that you all are aware that Marshfield is going to be in our network, right now. And our network is pretty extensive in most of our area, in most, if not all of our areas. So I just wanted to give a shout out about that. Also, there was a question as far as engagement on the carrier side with you all as far as navigators. I'm going to attend the trainings this year. So I'm going to think of a few ideas as far as having a little bit better engagement with Molina as far as with our navigators. I know that our Wisconsin team has been phenomenal as far as the engagement as far as with our navigators are concerned, but any feedback or anything that we could come up with to better help you, we'll be able to facilitate. Thank you.
Thank you, Fabian. Paul, want to take us home?
Yeah, thanks, Julia. It's I know we got 2 minutes on the last one, so I'll be brief. Yeah, just want to echo what I said earlier. This year is a unique year given the situation of the pandemic and the PHE, and now ultimately the redetermination process. So that's one of the reasons why we're excited about the broader network offering. We are, just I think for future and how we can engage. We're a platinum sponsor with Covering Wisconsin, so you'll see we're engaged with Julia and the team there. We've supported prior regional enrollment network meetings. I mentioned upcoming is one at the end of the month with both Milwaukee and I think Northwest with Mike Rust. We have reached out to the other RENs as well, so look for more information there. Like I mentioned earlier, we have dedicated hotline specifically for navigators and assisters, both an 800 number as well as a website. And then we also have a dedicated consumer hotline as well. So as you're having conversations and people have questions, you may be moving on to the next call, and you're going to get a lot of calls this year, right? We also have a hotline dedicated to those consumers so they can call us directly as well. The last thing I'd say is, when a member gets that Anthem Blue Cross Blue Shield card, hopefully it provides the stability, the strength, and the access to the high quality healthcare that they expect and deserve. It's something that we strongly stand behind and look forward to doing that not only today but in the future. So thank you all for your continued support.
Thank you, everybody. It's so great to put a human face to your plan, and even more to hear where you come from in terms of your desire to serve your members and to create healthy communities where you have your health insurance products. Thank you very much for participating today, for your beautiful, timely answers, and for allowing that everybody to get a last word. And I want to point out to the audience that at the end of this PowerPoint presentation, everybody has a slide with their contact information and any information about future trainings. Thank you all for joining. Thank you all of the panelists. Allison?
And thank you, Julia, very much. We have such a wealth of expertise in this state that we benefit from, and I've really seen it today, both with this session and the previous one. So thank you all for your participation. And before we depart today, the gift card recipient for today is Jordan Hibbert. So congratulations to Jordan, and we'll be sending that out to you after the conference ends. And tomorrow is our last day, so we'll see you here 9 a.m. tomorrow, and have a great rest of your day today.